Hey guys, Dr. Michael Derry here today, and I'm the owner of Revision Health Services here in Jacksonville, Florida. And today I want to talk about a question that always comes up, and I think it's important to answer: is ice or heat better for back pain? So let's say you have some back discomfort and you want to know if ice or heat is better. Hang with me, we're going to go over that right now. Okay, so you have some back discomfort and you want to know if ice or heat is better. The short answer is it really depends. And so let's say you have some acute discomfort. Acute means happened very recently. Sometimes ice can feel better because it can cause what's called vasoconstriction, which means it makes those blood vessels shrink a little bit, which in theory would cause less blood flow and less inflammation to happen in the area, and it can feel good. And so sometimes cold therapy or ice may be better for acute low back pain. But let's say you have chronic discomfort, and let's say you have back discomfort all the time, and let's say it's at the end of the day or after work or waking up in the morning. Well, sometimes the heat can feel really good to relax the musculature, and so there really is some variability. Two things I tell my patients all the time is, one, ice and heat really doesn't penetrate as far as we would like. And so for, let's say you have some stuff going on in your lower back, does the ice or heat actually penetrate down to that level to make a difference? That's hard to say. We just don't know enough, and to actually say that you're getting change at that deep level is really, really hard. It's very different than a superficial injury. So does it actually get to the depth? I don't know, right? And so we're still learning about that. The research is inconclusive. We used to think ice for everything, but now I think it's more of it really doesn't matter. So number two, I always tell them it's really your preference. If a hot pack or a warm shower feels really good, then keep heat in the area. It could give you some mobility and make you relax, right? So you can kind of get out of that muscle spasm. But if you feel like ice does really well, then use ice as well. Sometimes my post-surgical patients are like, hey, should I use ice or heat for this low back pain? Well, you have an incision, you have some healing going on in your back, so let's use the ice. That makes sense. But then let's say you've had discomfort for a long period of time and you like to use that hot pack because it relaxes you, or use that hot bath, or take a nice warm shower and it feels good, then use that as well. And so some key factors you want to remember with ice or heat: try to leave it on for about 20 minutes or so, and you want to make sure that you have a layer of cloth in between you and the ice or heat. You don't want to end up with a burn. You can get burned with ice as well. So you want to make sure you're protecting yourself, using it as recommended, 20 minutes or so, and then wait a while, and then 20 minutes again. And you can even alternate. Long story short here, ice or heat, it's really your preference. You can't go wrong with using one or the other, or even both. And so there's really a ton of flexibility, which makes it so much easier to kind of move forward through your day. Because if one day ice feels better and then the next day you use heat and that feels better, well, that's okay, right? You're allowed to have that change. And so ice or heat, which is better for low back pain? Long story short, it's your choice. So guys, as always, subscribe to the channel if you like the information, and leave some comments down below the description. And if you guys would subscribe to the channel and show some love, that'd be greatly appreciated. See you guys.